Welcome to Have More Babies. Today, we're tackling a topic that, well, it's probably on the minds of many of you listening: childhood allergies.
It really is.
Whether you're dealing with, a constantly sniffling kiddo, or maybe mysterious rashes popping up, or even navigating food sensitivities, understanding allergies can sometimes feel like you're trying to decode a secret language.
Absolutely. And we all just want our children to thrive,
Yeah,
right? So knowing how to manage these allergies is a huge piece of that puzzle.
definitely.
And to help us sort of make sense of it all, we've been looking at a really informative guide from Omega Pediatrics.
Ah, yes. Omega Pediatrics.
They have practices in Roswell, Alpharetta, and Milton, Georgia. And their materials, they offer a ton of practical advice.
That's great. So our goal here really is to pull out the most useful insights from their guide and maybe clear up some common misunderstandings about what childhood allergies actually are.
Exactly. We want to give you clear, actionable information you can actually use.
And look, right off the bat, if you find this helpful and want to dive even deeper, Omega Pediatrics has a fantastic website, loads of resources there.
Oh, absolutely.
You can find it at omegapediatrics.com. We'll definitely mention that again later, but, check it out.
Worth the look for sure.
And, of course, if you appreciate this information, please give us a like, subscribe to our channel for more helpful discussions like this one, and maybe share it with anyone you think could benefit.
Please do.
Okay, so let's get into it. One of the first things that really stood out from the Omega Pediatrics Guide is, well, the difference between just a dislike and a true allergy.
Yes, this is key. It's fascinating because, a lot of parents might think their child is allergic to broccoli just because they make a face and push it away.
Huh, yeah, I can picture that.
But a true allergy isn't about preference at all. It's a specific reaction by the immune system. It's physiological, not just, picky eater moment.
Right, right. That's such an important distinction. So, okay, let's talk a bit more about this immune system. Normally, it's our body's superhero, isn't it? Our protector.
That's the idea, yeah.
So what happens when it gets a little overzealous, maybe, and it causes an allergic reaction?
Well, think of the immune system as your body's defense force. It's constantly on the lookout for invaders like viruses and bacteria.
Okay.
In an allergic reaction, this defense system, it mistakenly identifies a harmless substance, could be dust, pollen, even a food, as a dangerous threat.
Ah, a case of mistaken identity.
Exactly. And then it launches an attack. That attack is what we experience as allergy symptoms.
Okay, so these harmless substances that trigger the reaction, those are the allergens. And the Omega Pediatrics Guide, it highlights some really common ones we find right in our home.
Yeah, quite a few, actually.
Let's walk through those. Dust is a big one mentioned. But it's not just simple dust, is it?
That's right. When we say dust, we're actually talking about a whole mix of things. There are tiny creatures called dust mites in there.
Ooh, mites.
Pollen that drifts in from outside, mold spores, and even those tiny flakes of skin that our pets shed animal dander.
Wow, so a dust allergy could be a reaction to any or all of those.
Precisely. It's complex.
It's like a whole little ecosystem hiding in plain sight. The guide also mentions fungi, these microscopic molds. Where do those usually hang out indoors?
Well, these tiny moles, they love damp areas.
Hmm.
Think bathrooms, basements, maybe around leaky pipes.
Okay.
They release spores into the air, and if a susceptible child breathes those in, it can trigger allergies.
Got it. And then, of course, there are our furry friends, pets.
Yes, the beloved pets. Cats and dogs are, common culprits. But the guide also points out that even smaller pets, like guinea pigs, gerbils, rabbits,
Yeah,
they can cause allergies too.
really. Even the little ones.
Absolutely. And it's not always direct contact with the animal itself.
Mm-hmm.
The allergens, they can cling to their fur, which then gets everywhere.
Right.
Even things like clothing or, say, stuffed toys made with animal hair can carry these allergens.
Mm. And here's one that might surprise some people: latex.
Yeah, latex.
Where would kids typically run into that indoors? Seems less obvious.
It's actually in quite a few everyday items, surprisingly. Rubber gloves that parents might use for cleaning.
Okay, yeah.
Some toys, balloons, definitely, and even the elastic you find in socks and underwear.
Wow, okay. So it's worth considering if you've got unexplained reactions happening.
Definitely. And one more, the guide mentions certain cleaning products.
Ah, yes. Specifically, ones with enzyme bleaches. It said those contain bacterial enzymes.
Exactly. And those bacterial enzymes can be allergens for some kids.
Yeah.
So ironically, our efforts to keep things super clean could inadvertently trigger something.
It's about being aware, I guess. Knowing what's in the products we use.
Precisely. So, okay, we've covered a lot of potential triggers. Now, what about the sign? What are the actual symptoms that a child might be having an allergic reaction? The Omega Pediatrics Guide gives a really thorough list.
Yeah, it's quite comprehensive. Let's start with the sort of head area, eyes, ears, nose, mouth. What are some telltale signs there?
Okay, so for the eyes, you might see redness, maybe puffiness, lots of itching. Sometimes those dark circles under the eyes, they call them allergic shiners.
Ah, yes.
And the nose. With the nose, think sneezing fits, a constantly runny nose, that annoying post-nasal drip, that feeling of mucus running down the back of the throat.
Yeah, that's the
And you
worst.
might also notice your child rubbing their nose upwards a lot, almost like a salute. That's actually called the allergic salute.
Huh. Didn't know it had a name.
Yep. And also congestion, or maybe they complain about itchy ear canals or an itchy mouth or throat.
Okay, quite a few things just around the face and head.
Uh,
But it doesn't stop there, right?
yeah,
Allergies can hit the lungs pretty hard, too.
they certainly can. Parents should watch out for things like a dry, hacking cough or maybe a whistling sound when their child breathes out that's wheezing.
Wheezing, right.
They might also have difficulty breathing, complain that their chest feels tight, or seem to get tired really easily during exercise.
Low exercise tolerance,
Yeah.
yeah.
And even rapid breathing or saying they feel short of breath, these are definitely signs to take seriously.
Absolutely. And then there's the skin, which is often where you see very visible reactions.
Yes, definitely. You might see itchy red patches of eczema that can look kind of dry and scaly, or raised itchy bumps called hives or welts.
Hives, yeah, they can pop up pretty quickly.
They can and appear anywhere on the body.
And it's interesting, the guide also notes that allergies can even affect the digestive system. That might not be the first thing people think of.
That's true. Digestive symptoms can include things like stomach cramps, just general discomfort, maybe diarrhea, nausea, or even vomiting sometimes.
So if a child has frequent tummy troubles, it could be allergy related.
It's definitely a possibility worth exploring with a doctor.
Okay. The guide also points out some other, maybe more general symptoms, like headaches.
Yeah, things like frequent headaches, restlessness, irritability, or just feeling excessively tired all the time. These can sometimes be linked to underlying allergies.
Wow. So with such a wide range of symptoms, and because some of them can look like, a common cold or other illnesses, it must be really tough for parents to figure out what's actually going on.
Absolutely. It can be very confusing. And that's precisely why the Omega Pediatrics Guide strongly emphasizes consulting a pediatrician for a proper diagnosis.
Yes.
You really can't or shouldn't rely on self-diagnosis when it comes to allergies in children. It's just too complex.
It seems so crucial. A pediatrician has the training, the expertise to look at the whole picture, consider all the possibilities, and figure out if allergies are the culprit,
Exactly. And then they can recommend the best course of action.
which might involve specific tests, right? Or maybe a referral to a specialist.
Correct. Could be allergy testing, could be seeing an allergist or another specialist. And once that diagnosis is made and there's a management plan, it's really vital for parents to, follow the pediatrician's recommendations closely.
Patient compliance, they call it.
Yes. That includes any diagnostic procedures they suggest and making sure your child takes any prescribed medications exactly as directed. Consistency is key.
Okay. So if a pediatrician does suspect allergies, what kind of tests might they actually use to pinpoint the specific triggers?
Well, the Omega Pediatrics Guide outlines a few common ones. One of the main methods is the skin test.
Skin tests, okay. And there are different types.
Yes, a couple of main ways. The most common is probably the scratch skin test, or sometimes called a prick test.
How does that work?
They place tiny amounts of purified allergen extracts, like for pollen, mold, pet dander, onto the skin, usually the forearm or back. Then they gently scratch or prick the skin surface through the drop.
Okay.
If your child is allergic, they'll usually develop a small, raised, itchy bump, kind of like a mosquito bite,
Yeah.
at that spot within about 15-20 minutes.
So it's a pretty quick indication.
Relatively quick, yes. There's also an intradermal technique where a tiny amount of the allergen extract is injected just under the skin. This is more sensitive, but might be used in specific situations. The pediatrician decides which is best.
Got it. And sometimes they might need other tests too, like imaging.
Right. Radiographs like X-rays or other imaging tests aren't for diagnosing the allergy itself, but they can be helpful.
How so?
Well, they can help rule out other conditions that might cause similar symptoms, especially respiratory ones that could mimic asthma. Or they might identify other factors contributing to breathing issues, like sinus problems.
Okay, that makes sense. And for kids who are having those asthma-like symptoms, the wheezing, the coughing, lung function tests are often part of the workup.
Yes, lung function tests or pulmonary function tests, PFTs, are important for assessing breathing.
Can you explain a bit about how those work? Is it hard for kids?
Usually it's pretty straightforward, especially for kids old enough to cooperate, maybe around age 5 or 6. They'll blow into a special mouthpiece connected to a machine called a spirometer. It measures how much air they can breathe in and out and how quickly they can exhale. Sometimes they'll do the test, then give the child a medication called a bronchodilator.
That's the medicine that opens up the airways.
Exactly. And then they repeat the test after a few minutes. If the airflow improves significantly after the medication, it strongly suggests asthma might be involved, often allergy-related asthma.
I see. That's clever. Now, the guide also mentions something called a sweat test. That sounds a bit different. Why would they do that?
Yeah, the sweat test isn't directly for allergies. It measures the amount of salt, specifically chloride, in a child's sweat.
Okay, why measure salt?
Because abnormally high salt levels in sweat are the main indicator for cystic fibrosis.
Ah, cystic fibrosis.
Yes, it's a serious genetic condition that affects the lungs and digestive system, and some of its respiratory symptoms can sometimes overlap with or be confused with severe allergies or asthma. So the sweat test is primarily done to rule out cystic fibrosis as a potential underlying cause.
Okay, so it's part of that process of elimination, making sure they have the right diagnosis.
Exactly. Getting the diagnosis right is the foundation for effective treatment.
Right. So once allergies are diagnosed, let's talk about managing them. What are the main ways to treat allergies and help kids feel better? The Omega Pediatrics Guide covered several options.
Yes, there are several key strategies. Medications are often, a first line of defense to help relieve those immediate allergy symptoms.
Like antihistamines, those are pretty common.
Very common. Antihistamines work by blocking the effects of histamine, which is that chemical the body releases during an allergic reaction that causes a lot of the itching, sneezing, and runny nose.
Are they mostly over the counter?
You can get many effective ones over the counter, yes.
Mm-hmm.
There are also stronger prescription options. A key thing to know is that some older antihistamines can cause drowsiness, but many newer ones are less sedating. Your pediatrician can help choose the right one.
Good to know. The guide also mentioned cromolyn. What's that one for?
Cromolyn sodium is often used specifically for nasal allergy symptoms. It usually comes as an over-the-counter nasal spray.
How does it work differently?
It works by preventing certain cells, called mast cells, from releasing histamine and other inflammatory chemicals in the first place. It's often most effective when used regularly, even daily, sometimes starting before allergy season hits.
So it's more preventative.
Somewhat, yes. And a big plus is that it generally has very few side effects, which is great for kids.
Okay. And what about decongestants for that stuffy nose feeling?
Decongestants, yeah. They can definitely provide quick, temporary relief from nasal congestion, whether they're nose sprays or pills.
Temporary being the key word.
Absolutely. The guide stresses, and doctors always emphasize this, that decongestant nasal sprays should only be used for a very short time, like maybe 3 days max.
Why is that?
Because using them longer can actually cause something called rebound congestion, where the stuffiness comes back even worse once you stop the spray. Oral decongestants don't usually have that specific issue, but can have other side effects like jitteriness or trouble sleeping.
Okay. Good to be cautious there. And then there are nasal corticosteroids. The guides seem to frame these as pretty important, almost like superheroes against symptoms.
Yeah, that's a good way to put it. Nasal corticosteroid sprays are often considered one of the most effective treatments for controlling the whole range of nasal allergy symptoms. The congestion, runny nose, sneezing, itching.
Are they safe, though? The word steroid sometimes worries people.
That's understandable. But these are different from the anabolic steroids people might think of. They work by reducing inflammation directly in the nasal passages. When used correctly at the prescribed doses for allergies, they have a very good safety profile, especially the newer formulations, and they aren't absorbed into the body in large amounts.
So they're targeted right where the problem is.
Exactly. Many are available by prescription, and some are now over-the-counter. They are often a cornerstone of treatment for persistent allergies. Your pediatrician can definitely guide you on the right one and how to use it.
Okay, so that covers a lot of the medication options.
Well,
But beyond pills and sprays, the guide also talks about allergy shots or immunotherapy. That sounds like a bigger commitment.
it is. Immunotherapy or allergy shots is a more long-term approach. It's usually considered when medications aren't providing enough relief, or if side effects are a problem, or maybe if someone wants to try and reduce their long-term reliance on meds.
How does it actually work?
It involves getting regular injections, usually at the doctor's office, containing very small, gradually increasing amounts of the specific allergens your child is allergic to.
So you're introducing the allergen on purpose.
In a very controlled way, yes. The goal is to slowly desensitize the immune system over time, teaching it not to overreact to those allergens.
Does it work?
It can be very effective for many people, especially for allergies to things like pollen, dust mites, pet dander, and insect stings. But it requires a confirmed diagnosis through testing, and it's a significant commitment, typically weekly shots initially, then maybe monthly, often for 3 to 5 years.
Wow, okay. Definitely something to discuss thoroughly with an allergist.
Absolutely. It's not a quick fix, but it can lead to long-lasting relief.
All right. So those are the main medical treatments. What about the practical, everyday things parents can do at home? The Omega Pediatrics Guide had some great tips there, too.
Yes, and these are really important because they can make a big difference in reducing exposure and managing symptoms day to day.
First and foremost seems to be avoiding the known allergens, right?
Exactly. That's step one. If your child is allergic to pets, as hard as it might be, that could mean restricting the pet from the child's bedroom, or maybe even finding a new home in severe cases.
That's tough. What about dust mites?
For dust mites, regularly washing bedding sheets, pillowcases, blankets in hot water, say 130 degrees Fahrenheit or higher, is key. Using special allergen-proof covers on mattresses and pillows can also help a lot.
And food allergies obviously mean strict avoidance.
Strict avoidance, yes. Reading food labels carefully, communicating with schools and caregivers, that's crucial for food allergies.
Beyond just avoidance, what about general lifestyle adjustments? Can those help manage allergies?
Definitely. The guide mentions things like using an air purifier with a HEPA filter, especially in the child's bedroom, to help remove airborne allergens.
HEPA filter, okay?
Vacuuming frequently, ideally with a vacuum that also has a HEPA filter, can help trap allergens instead of just blowing them back into the air.
Good point.
Keeping windows closed during peak pollen seasons, usually spring and fall mornings, can limit pollen exposure indoors. Making sure your child stays well hydrated can help thin mucus. And just encouraging a generally healthy, balanced diet supports overall immune function.
Those sound like solid, practical steps. Now, the guide also touched on natural remedies, but it seemed to add a pretty strong note of caution.
Yes, and that's really important. Some parents might explore things like saline nasal sprays or rinses, which can help flush out nasal passages and are generally safe. Steam therapy, like from a warm shower, might offer temporary relief for congestion.
What about herbal teas or supplements?
But that's where the caution comes in. While some herbal remedies are sometimes promoted for allergies, like butterbur or stinging nettle, the evidence for many of them is limited, especially in children, and some can have side effects or interact with other medications.
So the bottom line is,
The absolute bottom line, emphasized in the guide, is always talk to your pediatrician before trying any natural remedies or supplements for your child's allergies. They can advise on safety, effectiveness, and potential interactions. Don't just rely on something you read online.
okay, that's critical advice. It really sounds like throughout this whole process, understanding, diagnosing, treating, managing the pediatrician is the central figure.
That's exactly right. They're your partner in this. Working closely with your pediatrician is the most important thing you can do. They can provide that accurate diagnosis, recommend the most appropriate and safe treatments, tailor the plan to your child's specific needs, and give you ongoing personalized advice.
So it's not something parents should feel they have to navigate entirely alone.
Not at all.
Mm.
Building that relationship with your pediatrician is key to effectively managing your child's allergies.
Okay, so if we were to sum it all up, effectively managing childhood allergies really involves understanding the triggers first,
Yes, knowing what sets them off.
recognizing the symptoms, which can be really varied,
Right. Across different body systems.
partnering closely with your pediatrician for that crucial diagnosis and treatment plan,
Absolutely essential.
and then implementing those supportive strategies, those lifestyle adjustments and avoidance measures in your daily life.
Exactly. It's a multifaceted approach,
Mm.
but totally manageable with the right support and information.
And it's just so vital to remember, as we've said, always consult with healthcare professionals for personalized advice. Every child is different.
Couldn't agree more.
And for much more detailed information, really comprehensive resources on pediatric allergies and just general care for your children, please do visit omegapediatrics.com.
Yes. Definitely check out their website, omegapediatrics.com. They have a wealth of information there that you'll likely find incredibly helpful.
It really is a fantastic resource. And if you found this discussion valuable today, please give this video a like, Subscribe to our channel so you don't miss future insights, and please share this with any parents or caregivers who you think might find this information useful.
We'd appreciate that. Helping get good information out there is so important.
Absolutely. Understanding your child's allergies really is that first big step toward helping them thrive and feel their absolute best. So maybe a final thought for you listening. What specific questions do you still have about your child's situation that you can bring up with their pediatrician at your next visit?
That's a great takeaway question.
Thank you so much for joining us today as we explored childhood allergies.
Thanks for listening. Goodbye.
Goodbye, everyone.